Hi, this is Dr. Jaafer, Golzar Interventional Cardiologist here in Chicago. I have with me Dr. Jaafer Elder from Detroit Medical Center. Maher, you presented some incredible data today on your pulmonary embolism program in Detroit. Could you tell us a little bit about it?
Yeah, a few years ago we started the pulmonary embolism response team, and over the last few years we've been collecting the data. It's on route to be the largest data collection in a single center, and the data we presented earlier this morning suggesting that aggressive treatment of pulmonary embolism shows a better outcome overall for patients. They have massive and submassive pulmonary embolism.
So for a young hospital that doesn't have a PERT program, what would you recommend? How did you do this? How did you put this together?
Putting it together is going to entail, very importantly, having a multi-disciplinary team, which includes the vascular surgeon, interventional radiology, as well as MICU, the emergency room department. So various departments in the department all have to buy in this, as well as pharmacy and nursing staff. So it doesn't matter, even if it's a smaller community hospital, if you can get the team together, I think you're going to get the best outcomes. And it's important that all the members of the departments are involved because it really has to be inclusive rather than exclusive to one particular department.
And that's so important, and it's such an important treatment algorithm because these patients are going untreated, unfortunately. And you know, the work that you're doing in Detroit is really incredible. You've been part of CVC for several years now. Tell us a little bit about CVC and your involvement with the conference.
Well, CVC initially, when it started, the goal is to share ideas, learn new tricks of the trade, and the new pioneering technology and novelty. And over the last few years, we've seen it grow exponentially. Each year it gets bigger and bigger, but what's interesting compared to other conferences I've been to is that CVC is really inclusive to all departments.
Yes.
And for example, the talk I gave this morning, the crowd was mixed between vascular surgeons, interventional radiologists, pulmonologists, and so different departments all in the goal to learn more endovascular techniques. There's also credit that nurses can get as well as RT can collect. So it's a very unique conference where a lot of people can be involved. So our entire cath lab team and everyone involved in the cath lab, from the registered nurse to the CVT to the RT, can all come here and get their credit that they need for continued graduate medical education.
Well, Dr. Elder, we really thank you for all the hard work you're doing in Detroit and pioneering efforts nationally, and we appreciate all the work you're doing at CVC as well. Thank you.